Hours.
Wake up to purpose for living now.
Mentoring hour, we here once again.
You will build your soul. In this you will be the
It is a beautiful program.
You will be the answer.
Educative one, of course.
Sanity.
That comes your way
In this you will build
from one-to-one mentoring network.
will be the
Of course, together with our 24 radio.
Be the answer to
Today,
humanity.
we have Dr. Ivy.
And I know what state of God you are. It's a
And she's going to be talking to us about something many of us do not pay attention to.
Your purpose is a tragedy.
Well, it's a tragedy as well.
A disaster.
That many of us do not pay attention to that.
Sunshine, rainfall, head spins, the wind blows.
So stay tuned.
Monday,
Keep it locked right here.
purpose.
As Dr.
Sunshine, rainfall,
takes us through
the wind blows.
why dental prevention is better than cure.
Purpose.
Now you got it, isn't it?
The world is
You're scratching your head, isn't it?
you.
You're trying to remember when the last time you went to the dentist, right?
Free.
Perhaps you've never been there.
The world is waiting on you.
Today, Doctor will be giving us
Shine,
why it is important
oh, shine,
to visit a dentist.
shine.
Not just that too. Dental care. So without much ado, let's go straight to the lines and welcome Dr. Ivy this morning. Good morning, Dr. Ivy.
Good morning, Pastor Ivy.
How are you doing?
I'm fine.
Excellent. Today is just me and you, isn't it?
Yes, it is.
I'm hoping we will be having a very lovely time today as well. So
Same.
tell us a little bit about Dr. Ivy. I know, obviously, you must be a dentist, right?
Yes, I am.
So tell us a little bit about Dr. Ivy. Put us into perspective a little bit.
Thank you for the question. I'm an innovative dentist that helps patients to have healthy teeth, healthy gums, and confident smiles. I'm the founder of 10poundchallenges.com. Something unique about me, I write poetry, and also I like taking part in challenges, for example, hackathons. So last year, there was a hackathon with data scientists, and they said we should come up with something for coronavirus. So I took part in artificial intelligence versus Corona hackathon, and I was very proud when our team won the first prize. I'm a mentor, a leader, a visionary, an artist, an author, creator of recipes, innovator,
Hey,
problem solver,
hey,
teacher,
hey.
voluntary worker, NHS clinical entrepreneur, and a dental surgeon. Thank you.
Ah, see. Wow, you are a lot. You are a lot. Interesting. I've taken note of all the things that you are. And then I'll be falling on you if I need any of those services. Excellent. Now, we will be tackling you on your what you are as a dental surgeon today. And
Right.
you talk about dental prevention being better than cure. Now, for
Yep.
starters, what is dental prevention all about? What is dental prevention?
Well, I'm very passionate about prevention is better than cure. Um, you only have two sets of teeth in life, your baby teeth and your adult teeth. And losing your adult teeth is like experiencing bereavement. Your teeth are very important. They help you with your speech. They help you give you confidence. So if you do not take care of them, after you've lost the first teeth, which is the baby teeth, and you have your adult teeth for the rest of your life, if you don't take very good care of them, it affects your confidence in life. As I said, losing it is like bereavement. So it's very important to take very good care of them. And the reason why I believe in prevention is because if you ignore it and it becomes very, very painful, you end up spending more money trying to restore it, and it becomes a cycle. So I'm really proud to say that I've seen babies from baby, I mean less than a year old, to age of 16 with not a single decay because they listen to what I've been telling them. So I'm really proud of that.
Hmm. Wow.
Mhm.
Um, when I was young, I had the view that once you grow old, your teeth will come out. Yes, I had that view that once you grow old, say about 60 or 70 years, your tooth will definitely come out. But as you are saying, if you look after your teeth very well, you will take your teeth to your grave. Is that what you're saying?
Oh, yes. Oh, yes. I've seen elderly people with no dentures. They still have their natural dentition because they've taken very good care of them. So if you take very good care of them, yes, you're right. That's true.
In fact, in that case, we are all ears for you. How do we take good care of our teeth? What are some of the practical steps that we should go through so as we can take good care of our teeth?
Well, I'm going to start with the basics. I believe in starting with the basics to explain things to people. So one may ask, what is dental decay? So in simple language, I'm just going to simplify things. I'm going to keep it simple and short. Dental decay occurs when the bacteria in your mouth acts on the food you've eaten, which is normally contains sugar, and produces acid. And this acid in turn attacks the teeth and dissolves it. That is what is called dental decay. Now, the next question is what causes it? So it's mainly what we eat, our diet. And the next thing is how do we prevent it? So I'm going to give you some tips. The first tip is brush morning and evening with a fluoride toothpaste. I always tell people to go for toothpaste with fluoride at least 1,000 parts per million for the whole family. I'm not going to tell you which specific toothpaste to go for. I don't want to get into. So any toothpaste that has got fluoride in it, fluoride, it should be at least 1,000 parts per million. The whole family can use the same toothpaste, including children. It doesn't really matter. And the second tip is to spit after brushing because it is believed that when you brush, the fluoride stays on the teeth to sort of counteract the effects of the acid. So that is why we tell people to spit after brushing. The next tip is limit sweet to meal times. I never ever tell people do not eat sweets because it's not realistic. We all love sweets, but the best time to eat sweets is after food. So after food, I always tell my patients, after food, if you want to eat the whole of this room, I do not mind, as long as it's after food. Constant snacking means your mouth is always acidic and leads to problems. So it's best to limit it to meals. So when you have your main meal, you salivate a lot. And the idea is that because you salivate a lot after eating, it washes away the acid. The next tip is that for those who are in London or is to download an app. It is called Change for Life app. In the past, it used to be called Sugar Smart. It's an app you can download onto your phone. So if you go on the App Store and come across Change for Life app, now Change for Life app, they've got recipes there. This Change for Life app is an app when you download onto your phone becomes like a barcode reader. So when you go to the shop, you scan the sweets before you buy them. And it tells you immediately how much sweet is in the food. And it's quite an eye opener. So, for example, I scanned proper corn, and proper corn has got only 2 cubes of sugar. And then I did scan Co-op milk chocolate biscuits, and it came out with about 20 cubes of sugar. And kids love it because you're showing them that this is what happens when you eat too much sugar. As I said, I never tell no one not to eat sweets. You can have it, but please, please limit it to meal times. And also visit the dentist and hygienist regularly. Visiting the hygienist in the olden days, the dentist will have to see the patient and then refer the patient to the hygienist. But the law has changed. The hygienist can also open their own practices. So you can go directly to the hygienist without going to the dentist. But it's advisable to visit the dentist and the hygienist regularly. I'm not going to talk how often you should go because I have to be very mindful of different people's situations and how they take very good care of their teeth. So, for example, if someone has got high decay, I would be expecting to be seeing that person maybe every 3 months. If someone is medium, maybe 6 months. If someone is very good and very meticulous with their care of their teeth, we can say yearly. So it all depends on how you take good care of your teeth. I think that's it for now. Thank you.
All right, thank you very much. You spoke about brushing our teeth in the morning and in the evening, right? We also often hear people talk about brushing your teeth after every meal. Is that also something important?
Right. So you've got to be very careful there. I do not have a problem for you brushing your teeth after meals, but you've got to be very mindful. If, for example, you've had an acidic food in the morning, like juice, or something that is quite high in acid, orange, lemon, I don't know, anything that you've had that is acidic, and you take your toothbrush and you brush immediately after just having an acidic diet, you cause more damage to the tooth. So the idea is to wait some few minutes, at least maybe half an hour or something before you brush it off. So that is the only reason why you have to be mindful. And also the brushing, the best toothbrushes are medium bristles.
Mm-hmm.
One may ask, which one is the best, electric or manual? This is my personal opinion.
Mm-hmm.
I feel electric makes people lazy. The only time I recommend, this is my personal opinion, the only time I recommend electric toothbrush is for those who are heavy handed. So if you're heavy handed, I'll recommend electric toothbrush, which has got light flashing on it. Because back home, or we normally tell people to brush horizontally. When you brush horizontally, that is the normal way the teachers brush, and you are heavy handed, you end up cutting the teeth. So you see people come into the surgery and their teeth look so shiny and it's cut. You can see the marks on the teeth because they've been brushing too hard. The best way of brushing is to use the roll technique. So you try and hold the toothbrush at an angle of 45 degrees. This is something you have to demonstrate, between an angle of 45 degrees between the gum and the tooth, and then roll roll, like a roll technique. It's like you're brushing the gum onto the tooth and removing the plaque. If you do horizontal, you end up with gum recession, sensitive teeth. So you've got to be very careful. Thank you.
Wow. That means even brushing our teeth is a science. So, well, you also spoke about the best time for having sweets is at meal time, right?
Yes, after food.
After food, and then you said
Mhm.
we can eat, you can eat any amount of sweets.
Oh, yeah, because it's in one go instead of snacking. It's in one go. So you're sitting down and having that sweet in one go. The worst thing you can do is to be snacking all the time. So if every second you've got sugar in your mouth, it means your whole mouth is acid, acid, acid.
Mm-hmm.
And also, if you're taking juices, if you go to a party, I tell people as a treat, use a straw. Because when you go for these acidic drinks and you don't drink it immediately, you play around with it, it sort of dissolves the teeth. So you see people walking around with sensitive teeth. Sensitive teeth is very difficult to treat. That is why I'm passionate about prevention.
Mm-hmm. I see. So if I should sit down after meal and eat any amount of sweet that I want, it doesn't matter. The calories that I take in, it doesn't matter.
Oh, that is a tricky one. That's a tricky question. You need to find a balance.
Ah, oh,
You need
okay,
to find
okay.
a balance.
Uh-huh.
If you take too much sugar, fat, and everything, you need a balance.
Mm-hmm.
It's just like too much of everything in life is too bad. Even the food we eat, if you eat too much of it, you end up with illness. Or that's why I'm passionate about prevention. We can prevent most of the illnesses in this world if we eat a balanced diet. I know that's what they say.
Mm-hmm.
So it's I tell people just to be reasonable about it. Maybe a small amount, but at least you know it's in one go, rather than taking too much and then ending up putting some fat on the other parts of the body and then going to the GP and being told off that you have to lose weight. So you just have to find that balance. I'm flexible
Oh, okay.
as long as you know what you're doing. Yeah.
I see, I see. And that balance, you can find that balance with the app that you told us about, Change for Life.
Change for Life app,
Yeah.
because it's quite educative. The
Mm-hmm.
fact that you can just download it onto your phone and your phone's camera becomes a barcode reader. Immediately you scan the barcode and it tells you how much sugar in the food. That's quite an eye opener. I see people are shocked to see how much sugar they have in everyday food. So you need to find that balance. Yeah.
Okay. I know dietitians talk about we not eating late in the night, right, or late
Mhm,
in the evening.
mhm.
Will the dentist also tell us that the times that we eat, possibly late or quite close to late
Bedtime.
bedtime, does it also have any effect on our teeth?
Yeah, it will have an effect. So the only advice is before you go to bed, brush your teeth. Because if you eat sweets or you eat something starchy or whatever you eat, it's like I feel like everything in the world has got some sugar hidden somewhere, and you do not brush. So those bacteria because you're sleeping and you're not salivating a lot, you're not producing a lot of saliva. That's when the bacteria is able to act on the sugar. And a very good example is breast milk. Parents who leave the breast in the baby's mouth, I'll immediately the child falls asleep, take the breast out. If you leave the breast in the child's mouth throughout the whole night, the sugar in the milk. So it affects the child's teeth and it leads to a lot of decay called Nelson caries. So the advice is if you are breastfeeding the child and the child falls asleep, please take the breast out. Because the teeth in touch with even if it's a feeding bottle, you'll be surprised. The next thing you realize is decay. Because saliva rate decreases when you're asleep, and then the bacteria go to work on the sugar and to produce acid. And it is the acid that attacks the teeth. One of my patients gave me an analogy, putting a extracted tooth in an acidic drink. I'm not going to mention. And she said the whole thing dissolved. So soft. And the enamel is the hardest substance in the body, very hard. So can you imagine? Anyway,
All right, interesting one there. So that was a very good advice to nursing mothers. But some grown-ups also sleep with their breast in their mouth. Is that also advisable?
oh gee, are you sure about that?
Oh, yeah,
But
yeah,
nobody
yeah.
doesn't produce milk.
That one, no problem, right?
And there's another tip
Uh
that
huh.
I'm very passionate about.
Okay.
Now that I'm on, I believe prevention is better than cure to be told to parents at an earlier stage.
Mhm.
And this was based on my master's.
Mhm.
So I'm not just saying it. I actually had a focus group meeting with parents. And when parents become pregnant, the first people to visit them is normally the health visitors. So it's very important. Parents are not sure when to register the child. As soon as your child has got teeth in their mouth, you start brushing their teeth. The teeth comes around 6 months, but some children are delayed. So it may come 8 months, 9 months. So I never give an age. I always just say immediately the teeth comes into the child's mouth, you got to start brushing with a special toothbrush and a special toothpaste for children. And also you need to register the child. So when you register your child at a very early stage, one, the child gets used to going to the dentist. and is no longer scared when they become an adult. And also, if there's a cavity, the dentist is able to see it and feel it. So if there's a cavity in a child, I feel it immediately. I do not ignore it. Not everybody is able to do that. So I start advising their parents. If you don't do that and you ignore it, what happens is, and listen to this is very important. What happens is the child ends up with a lot of decay. When the child has a lot of decay, some dentists, not everybody has got the patience to be able to close the child and fill the tooth. So in the end, the only option they give will be to put the child to sleep, to have the teeth removed. And that can be very traumatic for the child. And this costs the health service about £35 million a year, just putting children to sleep to have teeth removed. Because general anesthesia, when a child is put under general anesthesia to have teeth removed, you have anesthetists, you have nurses, you have clinicians in the room. And that money should rather be spent on special needs. Those who maybe cannot be able to brush properly, or they can't speak, they're non-verbal, or they have special needs, so that we rather use that money on those kids. Those who are healthy should rather practice prevention. And it's quite traumatic. When the child's teeth is rotten, you, the parent, will have to take time off work, go to the hospital, sit down with your child after the teeth is removed, and then it takes a long time for the new teeth to come through, because the baby teeth is there to guide the new ones into the cavity. So please bear this in mind. Thank you.
That's a very good one for parents. So the moment you see the baby's teeth coming out, you need to start brushing.
Yes. There are special toothbrushes for babies and special toothpaste for babies. You need to start brushing. And you have to brush the tongue as well. A lot of people, when they brush, they don't brush the tongue. And then when you are eating, you have to eat slowly as well.
Hey, you have to eat slowly.
Yeah.
Why should I eat slowly? Maybe
If
I'm
you
in a
rush, and you eat, you don't digest the food properly. So when you belch, you end up with bad breath.
All right, so we need to take our time and eat. Some parents even feed their little ones with some of our African dishes, not just baby food.
Yeah.
They give them some, little bit of benkun and, a little bit of rice and what have you. So I think,
Yeah.
as you said, it is very important that the very moment the teeth comes out, you need to start brushing the teeth. And you said there's a special toothbrush for that, right?
Oh, yeah, they've got kids' brushes. It's in the
Kids
shops.
brushes. Okay.
So just for children, it's age appropriate. So they've got brushes for different age ranges. So yeah.
Okay. Thank you very much for that. You also said that the best brush we need is the medium.
Medium bristles, medium.
In fact,
Not too hard, not too
hard.
soft,
Okay.
and not too soft.
Not too soft. Well,
Yeah.
some African men and women want the ones that when you are brushing, you can hear the sound from afar.
That is very dangerous, because what happens is your gums start receding, and then you see some people have calculi, tartar build up, and with that you can't remove it with any amount of toothbrush. You have to see the hygienist to remove it. Hygienists are trained to remove plaque and calculi. Calculi is tartar. It's those hard substances you see on people's teeth. And what it does is, because it's very close to the gum, it irritates the gum. So it's just like someone scratching and pinching you. And that is why it bleeds. A healthy mouth should not bleed. So immediately your gums start bleeding, you know there's an underlying problem. And also, people who are diabetic are very prone to losing their teeth quickly. So you've got to be, so people who are diabetic need to be seeing the hygienist regularly. I remember having a patient, I keep on telling him how to take it seriously. And in the end, he would manage to keep most of his teeth. But those who ignored my advice just lost their teeth rapidly. And then they have to wear dentures. And I've always told people, losing your teeth is like bereavement, because immediately you lose your teeth rapidly, your face falls in. The longer you keep your teeth in your mouth, the more it gives shape to your face.
Mm-hmm.
People don't know how important the teeth is. If you can't pronounce certain words. I remember I learned, I'm not going to mention it, this was a special politician.
Uh-huh.
She had some dental work done, and then after that, she lost the election because she couldn't speak like the way she used to speak at first because it affected her speech.
So what are some of the words that you cannot pronounce so that we at least
Mississippi.
oh, Mississippi, right?
So, so if I've done a denture and you want to see if the denture, you've done a good job, you tell the patient to say Mississippi. If
Oh,
they can't say
the,
Mississippi, then you know you haven't,
then
there's a problem
oh,
somewhere.
I
And
see.
also, there's another thing I want to mention. Um, there's another thing with children and adults. Some children and adults grind their teeth at night. And grinding your teeth at night is a sign that you are stressed. So that's another tip. So if you've got a child and the child goes to school, you don't know what's going happening with that child in school. The child comes home and is very quiet, or they've just moved on. So I may see a child and then I may say, the parents may say they are grinding their teeth. So I'll just ask, are they stressed? And then mom will say, oh, they are writing exams, or we've just moved home, or something has just happened. So if there's a traumatic event in a child, they may start grinding. So you know there's an underlying problem. So maybe there's something happening in school they've not even told you about. So those are things you have to watch out for.
Thank
And
you
in
for
adults as well,
mm-hmm.
especially during the pandemic, a lot of people were breaking their teeth because of the tension, the stress, clenching. Some people don't talk about their feelings, they don't talk about their problems, they keep it to themselves, and therefore they harm themselves by grinding tension. When it happens, we provide them with soft by guard because we believe in breaking the cycle. When you are tense, it's not a very nice experience. And yeah, so the mouth, I always say the mouth is like a mirror of the whole body. When you look in people's mouth, you can detect a lot of things. For example, if I see cold sores, there are certain illnesses, we call it oral systemic diseases, oral systemic manifestations. So it means things happen in your mouth before they attack your whole body. So if I see someone coming in with ulcers, recurrent ulcers, it means the person is run down or maybe deficient in some vitamins. So I would advise them maybe you have to see your GP for a routine blood test, or someone whose gums is just bleeding for no apparent reason. For example, pregnant women, when people are pregnant because of the hormones, their gums bleed more. So there are a lot of things you can pick up from people's mouth, like ulcers, people who smoke and drink, their oral cancer rates is higher. So you've got to become your own detective. So if you start seeing lumps in your mouth, or if you've got an ulcer in your mouth, that's another tip. An ulcer in your mouth that has not healed after 2 weeks, then you know that you need to seek medical attention. It could be something else. But if it comes and it goes off, then it means you are run down. And you need to, people are just, I don't know what's happening. Some people work around the clock. And the body analogy is like a machine, it's like a car. You got to listen to your body. So yeah, thank you.
Hmm. You touched a little bit on smoking, right? I want
Yeah.
you to throw a little bit more light on that. Smoking
Okay.
and our teeth. Uh-huh.
So smoking, what happens is when people smoke, it affects their gums. So their gums bleed more. So I'll always say, and they have more stains. So when they come in, they expect you after cleaning their teeth to be looking white, but there's a lot of stains because of the smoking. So it may look black or brown. So they need to see the hygienist and it bleeds more. And if you smoke and you drink at the same time, your oral cancer risk is high. Your risk of getting oral cancer is higher if you smoke and drink. So this is something you need to let people be aware of. And everybody should be a detective. You try and look for at your face for lumps. So if you see your facial symmetry means if one time your face is swollen, one side, you need to seek attention. If you find any lump that is like we have a lot of lymph nodes around the neck, and maybe it is rubbery and a little bit hard or something, you need to seek attention. If there's any swelling, if you got a toothache and you ignore it, and then it gets swollen, and you do not seek attention, the swelling can spread rapidly and it can even block your airway. You need to go to A&E as soon as possible. If you've got broken teeth in your mouth, if your oral hygiene is very good, I only monitor it, but there's a probability it may get infected and may spread. So you advise people to have it removed as appropriate. If the person's oral hygiene is really good, I'll just keep an eye on it. So those are things that we need to look out for. So people take it that the teeth root, you can have a toothache, ignore. A healthy teeth has got the enamel, the dentine, and then the nerves. So if you have a little hole and you go to the dentist and they fill it, that is fine. If you ignore it and it spreads to the nerve, and toothache is very painful. It's not a nice pain. I know what I'm talking about. It's a horrible pain. And when you have that toothache and it's keeping you awake at night, it means it's gone to the nerve, it's gone too far. So your only options are, do you want to save it or do you want to take it out? If you save it and you have a root canal treatment, after root canal treatment, it does not mean you may not end up having the tooth lost, removed. It's just buying time. It's just saying that, yes, I know my tooth is bad, and the best person to go to for root canal treatment is the endodontist, because they use a microscope to do a good job, and they'll charge you a lot for it because they use a microscope. So there's a lot of information. Yeah.
Well, you also touched on toothache. In fact, the moment it came to mind, you touched on it, right? Is it something that we can prevent with as you advised earlier on?
Yeah, you can prevent it. Yeah, you can prevent it if you brush your teeth regularly with twice a day with toothpaste. You floss or use toothpick to remove food from in between, because when you brush, you're not able to clean in between your teeth. So you have to use floss or toothpick to remove any food in between. You limit sweet to meal times. You visit the dentist and hygienist regularly. You should be fine. But if you ignore it and things get worse, then some people haven't been for 2 years. Some people haven't been for 20 years. Some people haven't been for 10 years. Some people only go to the dentist when they are in pain. By then, things have gone really bad. When it's best to go have a checkup. So if you come meticulous with a checkup, you have your hygienist, you just have a checkup and they see everything is fine. They take an x-ray. There's a special x-ray we take like every, depending maybe every 2 years or whatever. It's called bite wings. So it's an x-ray of both sides. And what it does is it's like a standard. So every 6 months or every 2 years or whenever you visit and we take another set, we are able to compare to see whether you've been good or you've not been taking things seriously. So yeah,
good
I'm
one.
passionate about prevention. Yeah.
Thank you very much. This question is from Mr. Kwaku Eduardo. He's asking about tooth whitening products.
Okay.
Yeah, is it something that we can fall on?
The best person to do teeth whitening is the dentist. There are lots of products out there, but everybody is trying to come up with something. So you never know which one is the best or not, because we all know that any good thing, there's always something that is not what it says it is. So you have to be very mindful and careful. So if you want your teeth to be whitened, just go to the dentist and then they discuss their options with you. Yeah.
Okay, all right. So we should be mindful of the products that we buy
Yeah.
to whiten our
It's
teeth
best to go to the
to
dentist.
the dentist.
The
Good.
best person to go to is the dentist. Yeah.
Good. We've been talking to Dr. Ivy on dental prevention being better than cure. In fact, she said a lot as to how we'll be able to take care of our teeth. Imagine Papa Smiley sometime to come, I lose my teeth. How would I be able to smile? And how will I be able to have my confidence like this? No. So I need to take good care of my teeth. brushing first thing in the morning and before night, before sleeping. And also, one thing that I've taken note of is you limit snacks to meal time, because it helps reduce the amount of acid. Did I get it right? Acid in your mouth,
Yeah,
right?
yeah.
Excellent.
I use the fluoride toothpaste
You use
because the
you use
fluoride helps make the teeth stronger. So
mm-hmm,
when we see children every 6 months, we apply the fluoride.
mm-hmm,
The fluoride we apply as a preventative measure
mm-hmm,
is more concentrated. It's only applied by the dentist.
mm-hmm.
So yeah. So
Okay.
if a child is prone to decay, I always just say just use the same toothpaste as mommy and daddy.
Mm-hmm,
If the child is prone to decay again and they reach a 6, 7, at times you can do fissure sealant
mm-hmm.
on the first molars. The first molars come around a 6 to 7. They'll be with you for the rest of your life.
Okay.
So what we tend to do is, when you look at the teeth, new teeth comes through, there are grooves. So those grooves, if the child eats a lot of sweet, the sweet goes into the groove and causes decay. So at times you can just seal it and make it shallow.
Mm-hmm.
So those are things that you can do. It's just a preventative measure.
Preventative
Yeah,
measure. All right.
yeah.
Um, back in Ghana, right? I don't know about other African countries. We use chewing sticks.
Chewing stick and chewing sponge.
Yeah, chewing
Yeah, I
sponge.
don't have a problem with that.
Uh-huh.
Some Eastern they use the shua. I remember one of my patients bringing it from Eastern. You soften it and then use it to clean. As long as it does the job. But my training, we've always been told to brush twice a day and
Mm-hmm.
use the fluoride toothpaste because the fluoride incorporates into the enamel to make the teeth strong. So
Mm-hmm.
that's what it is. And this is there are two schools of thought. Some people who are very conscious of their diets would say they don't want fluoride in water. But the fluoride in water helps also with teeth decay. So places that they didn't have fluoride in the water, you see that they have a lot of decay. And then there was a country, a Japanese country somewhere, that they didn't have sweets because even in this country during the 40s, when there was rationing of sugar, there was less decay. Immediately there was sugar, the caries increase. So that tells you how important it is, how sugar can affect the teeth. So one has to be very mindful.
Right. Lately, I've seen charcoal toothpaste. Back in time, we used to put charcoal. I think
Yeah,
yes, yeah. We used
charcoal
to.
toothpaste. Yeah,
Ex-
to me, I don't know. Some people believe in it. Some people say it's holistic. They don't want fluoride, and they want as long as you are happy it cleans your teeth. That is between you. I would My policy is I'll tell you what I think. I'll be honest with you. I'll give you the pros and cons. I'll give you the complications, the risks, the alternatives, and the benefits. There's something I believe now in called shared decision making. Gone are the days where you tell people, the patient, do this, do that. Times have changed. You need to involve the patient in the decision making. They know their body. So both of you have to come to an agreement. So, for example, if I'm doing a denture for a patient and I have to choose the color, I get the patient involved, or I may tell them if your partner, you want to come with your partner, we choose the color together. Because what I don't want is to finish the denture and then or the crown and then turn around and say, I don't like the color. When you've already paid the lab bills and everything. So I try to always get my patients involved in my decision making. It's very important. So we all in it together. We all have to take some form of responsibility and accountability.
hmm. Uh, as I said earlier on, I thought once you grow old, your teeth will come out. So, more or less, I saw old people back in Ghana whose teeth have come out as part of life. It's just something that comes. And one thing that I also thought as well was the wisdom tooth. And they say it will get to a time that it will come out. So all those things are myth, right? It's not true.
Well, we are all different. Some
Mm-hmm.
people are, excuse me. So we are all different. Some people are walking around, their wisdom teeth never came out. Some people's own comes partially erupted. So again, in the past, when people's wisdom teeth are giving them problems, we tell them, oh, go take it out. But it's a major operation. So now there's a new guideline by the National Institute Center of Excellence, NICE guidelines. And it states that when your wisdom teeth is coming through, you need to have 3 bouts of infection before you think of even taking it out. And it's not every wisdom teeth you need to take. I have to be very careful because some people, um, wisdom teeth, their root is very close to the nerve, and that nerve supplies the whole head and neck area. And if you are not careful and it gets damaged, you may end up with postoperative pain, swelling, numbness of the lip and the tongue, and which may not recover. So when it happens, they may have to do a scan to see where it is. And if they think it's too risky, they may just remove the gum so that you can be able to clean it properly, or they may just take part of the crown and leave the root in situ. So gone are the days that we tell, and even if you keep it clean, I always tell people if you don't allow food to go underneath the flap, you wouldn't get any inflammation. But if you ignore it and food start going underneath the flap, then you keep on getting all these recurrent infections. But it can be prevented. But some can never be prevented. If the patient comes in and says, look, I've had 3 bouts of infection, enough is enough, I just want it out. So those are things you have to look at the x-ray. If you think it's too complex, you refer them to the hospital or you refer them to a specialist to take it out. So one has to be very mindful. The head and neck is a very complicated area. When in the medical school, is the most complicated part of the body because you've got the brain, the nerves, and everything to dissect. So it's a very complex part of the body. That is why when you have pain, you have something called referred pain. So if you have referred pain like headaches and things like that, you need to see a specialist. If you think it's coming from the teeth, if you don't take care, you may end up having your whole teeth removed and the pain is still there. So you've got to be mindful of all those things. It could be a
Wow.
neuralgia.
Mm-hmm. 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 Interesting. You are sounding quite scary to some of us, but it is good to know. It is good to know so that you prepare yourself, you take good care of yourself, which is very very important. One other thing is chewing gums, right? A lot of people love chewing gum a lot, right? Has it got any impact, or is it something that helps? Or which
Yeah.
particular kinds of chewing gums
So,
should we
so
avoid?
sugar-free gums.
Mm-hmm.
Sugar-free gums are quite good for those who are not salivating properly. Some people take certain types of medication, and that medication affects saliva flow. So they may be prone to a lot of decay. Or, for example, they've had surgery around the head and neck area. So they suffer from dry mouth. When you suffer from dry mouth, you can't even speak. You need saliva to be able to even speak or articulate certain words. In that instance, to relieve that sort of, to give them some comfort, you may encourage them to have a sugar-free gum. But it shouldn't be constant. Maybe you have to be very mindful. It should be sugar-free and limited. In that case, justifying helping that patient because they are suffering from dry mouth. Dry mouth is not a nice thing, and at times some people have certain medication that affects them that gives them dry mouth, or they've had some operation around the head and neck area. So in that instance, that is to give them a sort of relief.
Right. Thank you very much for that. One more thing, maybe two more things to talk about. Mouth odor. Yes, mouth odor. Um, um, Once again, many people thought mouth odor, bad smell were to do with something in the head or what have you, you know. Mhm. Now, is that the case, or are teeth can also
So
give
you need
us
to
mouth
see
odor?
a specialist for that.
Mm-hmm.
So there are some mouth odor. It's a very difficult thing to treat, but there are some that are untreatable. So you need to see a ENT. It could be you've got some tonsillitis or something going down your throat. So you may see a specialist. But mouth odor simply can be caused when you don't brush your tongue, you eat too fast. So when you eat too fast, you're not able to digest the food properly. So when you belch, it smells. And also, some people eat spicy food. So you have to find out. It's just like putting perfume on. If you put on perfume, it will smell differently on you than someone else. So there are certain people, when they eat certain foods, the bacteria breaks it down and it gives mouth odor. So you have to find out and work out which food is it that when I eat, my mouth smells. So maybe if I may eat garlic and my breath will not be fine, someone else may eat it and the breath will be very bad. And you need to see the hygienist. So some people have got really gums bleeding, a lot of tartar. They haven't been to the hygienist even in their lives, their whole life, never been to the hygienist. So all those have built up, and then it needs to be scraped off, and they need to use a special mouthwash. There's a special mouthwash from America. It's called Retadex for bad breath. And recently, I saw somewhere that probiotics can also help if there's an imbalance in the bacteria. It helps, but I just read about it. I don't have the evidence whether it works. It's one of those things that you have to try. They say probiotics. It's a tablet you drink and then it will help. But my advice here will be to see the hygienist. Eat slowly. Don't eat too fast. Brush your tongue, because if you leave it on your distance on your tongue, you can use a mouthwash for, and then see how it goes to be reviewed. If it still continues, then you need to see a specialist. There's an underlying problem somewhere. So yeah.
Okay, thank you very much. You also spoke about visiting the dentist regularly, and
Yeah.
some people say visiting the dentist is costly.
Yeah.
It's
Yeah.
very costly. Well,
Yeah.
are there any facilities for certain kinds of people who may want to
Yeah.
visit a dentist, but they may not
Yeah.
have
So
that money? So take us through.
yeah. Yeah.
You will possibly know. So take us
Yeah.
through some
So
of the
in
facilities.
this country, in London, they have NHS and they have private. Now the NHS, the government pays part of the money. So they've decided to keep it simple for patients. So we've got four bands. So band one is a checkup, band two is a filling, band three is if you need a lab work like a crown, a denture, or a guard. And band one, I don't know the price of so I'll just give an approximate. So band one is about £24, band two is about £68, band three is about £282. So these are NHS. And if you need an emergency, it's £24. And for children under 16 is free for them. If you're under 18, it's free. But if you're 18, you have to be in full-time education to get free NHS. But now it's very difficult to get an NHS dentist. So it depends on where you are in the country. So if you are lucky to be registered with an NHS dentist, it's not every treatment they may do. So if it's cosmetic, for example, you need a white crown on a back tooth, it's not going to be done on the NHS. It's going to be private. And that person will set their own prices, but it's a private practice. And some of them have got plans. So it all depends. If you are pregnant, you get free NHS care. If you are if you're on income support, if you're on universal credit, if you're on job seekers allowance, so you get it free. With that is, you have to register with an NHS dentist.
Okay.
Unfortunately, because of the pandemic, it's very difficult to get access to NHS. So your only choice is to go to an independent, someone who is running it as private. So that's where we are now.
Hmm. Well,
And
as
if you
we.
got an emergency problem,
Mm-hmm.
you can call 111, not 999, 111, and then they will triage you. If they think you need antibiotic, they will refer you to a dentist who can prescribe antibiotic for you, or they may refer you to a dentist who will see you in your area closer to your home. But that's just emergency, that's not routine. And it's not good to wait to be in pain before you go to the dentist. So if you have a regular dentist that you see, you build a rapport, you build a relationship. So every 6 months, you just come, you have a checkup. Anything, is there anything wrong? Nothing is wrong. You have your clean and polish, and then you leave. That's it.
All right. Two more questions. Two. Someone is asking, after brushing my teeth, how would I know I have done it properly? Is there something that I
Very
can
good
use?
question. Very good question. Very, very good question. So what you could do is go to the pharmacy and buy disclosing tablets. It's called disclosing tablet. And it could be pink or it could be blue. But you've got to be very careful, mindful. So this is how you use it. The disclosing tablet, before you do it, you have to put some dirty a cloth that you are not using on the floor. Put Vaseline around your lips. Chew the tablet. Do not swallow it. Spit it out, and then you see that to mark out all the plaque in your mouth. And then you brush. So when you brush, you see the plaque coming off. So when the color comes off, it means you brush properly. If you brush and the color is still there, it means you didn't brush properly. And it's called disclosing tablets. Normally it's pink or blue. So it's a very good, kids can use it, but with kids, you've got to supervise them. Also, dirty the whole sink and the floor because it stains the plaque and the tartar in your mouth. So that's a very, very good question. Thank you for asking.
And you said it's what? Disclosive
Disclosing tablets.
disclosive tablet.
Disclosing. So D for driver,
Mm-hmm.
I for indigo, S for sugar, C for cat, L for love, O for off, S for sugar, I for indigo,
think-
N for November, G. Disclosing tablet.
Okay.
And they've got different colors.
Different
pink,
colors,
blue,
right?
purple.
Mm-hmm.
Yeah. And you get it from the chemist, the pharmacy. Yeah.
And you don't have to use it every day. At least once in a while,
Yeah,
so-
it's a training tool. So if you've got a handover of the brushing, and yeah, then and also I always tell people if your brush bristles are splayed means when you roll it and it, excuse me, you see people's toothbrushes, the bristles are no longer straight, they've gone sideways. Instead of them changing, they continue using it. So that's another thing you have to watch out for. And also when you are brushing, you've got to do the roll technique. If you go like that, you end up with gum recession. The reason why you end up with gum recession is because the gum will never grow back to cover that area and it becomes sensitive. And sensitive teeth is very difficult to treat. So one has to be very careful.
Thank you very much for that. Now, wearing of gold teeth. Uh-huh.
Yes.
Yes.
Yeah.
It's particularly among with the blacks. Is it
Yeah,
important?
that is fashion.
Mm-hmm.
So, excuse me. I remember having a young man requesting for a gold crown. So I explained to him that I'm going to do it in such a way that when he changes his mind, all we have to do is just take it off. So I'm not going to be, before you do a crown, you have to cut the tooth down to make a crown. So if you're going for this fanciful gold, the best one is like the grid, like the American grid that you put in and then take it out. It doesn't damage your teeth. So the best gold ones are the ones that you put in, or when it is cemented onto the teeth, you are not damaging your teeth by cutting the tooth down. Because I told him, you're a young man, you may grow up and then you have to go for an interview and then you may need to take this gold tooth off. So it's best to do the ones that to be easy to flip it off rather than damaging your own teeth. So I know it's fashion, but you have to think twice about it. Anything about the teeth, when immediately you touch the tooth, it becomes a cycle. You're not going to be able to go back to it. When you touch it, that is it. It's a cycle. So if you've got a little cavity and you feel it, and then you keep on eating sweet, the next time you go back, they have to prep the tooth, the hole becomes bigger, the tooth becomes weaker. So you have to be very mindful of all that. So yeah.
I know you said you are a mentor as well, right? Uh-huh.
I'm a what?
You said you are a mentor.
Yeah.
Okay. Yeah. So
Yeah.
let me ask this. Wearing of a gold plated teeth to an interview
Yeah.
is not appropriate, right? It's not good.
Wearing a what?
The gold teeth, okay,
To wear?
to an interview is not good.
Well, it depends on the job you are going for.
Okay. So what
If
what
the
what what?
culture, if the culture of the organization is that everybody wears blink,
Uh-huh.
you want to fit in. It's a peer thing. You want to fit in with the crowd. So you've
Uh-huh.
got to you do what who the caps fit. So you also want to fit in.
Mm-hmm.
So peer pressure. So it all depends on the job you are going for.
Mm-hmm. Oh, okay.
Yeah.
All right. I see. So, thank you very much for that. As you advised that young man, you may be attending an interview and you may need to take it off. So, you use the ones that you can easily take it off. Very, very, very
Yeah,
important.
that's the American. You can see it's a grid. They do it and they just it's like a clip on, which is brilliant. So if
Mm-hmm.
you haven't damaged your teeth, you put it on when you want to go out. I prefer that one than but if it's a single one, there's a probability you may end up swallowing it. But that one is like a grid. So it
Mm-hmm.
sits nicely.
Mm-hmm.
So one has to be very careful.
All right. One other question just came into mind. Braces, right?
Yes.
Uh-huh.
Yeah.
Yes, braces. Can anyone wear it, or you can wear it up to a certain
You
age?
wear it to straighten your teeth.
Mm-hmm.
So there are braces. So if you're on the NHS, if you're lucky, your child. So if I see a child that I think this child has got like, in Ghana, if you've got um, a gap between your two front teeth, beauty. So you can decide to leave it or you can decide to close it. Or some children, they suck their tongue. So because they suck their tongue, their teeth project forward, and then there's a little gap left where they've been sucking their tongue. So they may need braces. So immediately that they are a child and I see a problem, I refer them to the orthodontist for early intervention. So because children under age 16, if you are lucky, they've got a criteria. If you're lucky, then you don't have to pay for it. But if you're not lucky, then you have to pay thousands of pounds to straighten the teeth. And when this pandemic came, because of the Zoom calls, people noticed that some of their teeth is slightly crowded. So you can have Invisalign. Invisalign is invisible braces. So you are wearing the braces and no one sees it. So yes, braces can be used for two things, for cosmetic and then to resolve a problem. So a problem would be like a child whose two front teeth are projecting. And because it's projecting, when they go to school, they may get bullied because of their teeth projecting forward. So in that case, it's a good idea to maybe help them straighten it because you don't want your child to be subjected to all sorts of bullying because of their teeth or the shape of their teeth. So you need to see the orthodontist. Yeah.
Wow, very, very educative, very, very helpful today. Your final words for us. Mm-hmm. In some
Prevention
brief words,
is
yes.
better than cure.
Prevention is better than cure. There was a joke. This young man met this lady in a club, took her home, and when they were going to bed, the lady took off the dentures. In fact, the gentleman ran away. Uh-huh. So if you don't want that to happen to you, prevention is definitely
Is better
better
than
than cure.
cure.
Thank you very much, Dr. Ivy, for
Oh,
making
thank
time
you.
with
Thank you
us.
for having me. It's an
Mhm.
honor. Thank you. Really appreciate it. Thank
Excellent.
you.
Uh-huh.
Yeah.
We've been talking to Dr. Ivy, a dental surgeon, also with one-to-one mentoring network,
Mentoring.
right?
I'm the
Excellent.
program director.
Program director. She's also a mentor, right? She can mentor you on how to keep your teeth very clean. Yes, for that one, I know. I know for sure. So thank you very much, Dr. Ivy,
Thank
and
you.
hopefully,
Thank you for having
on the 28th or so, I think we're having you with the other colleague,
26.
26, right?
With Samantha and Yasmin.
And
We'll be
Yasmin, yeah.
talking about burnout and yeah, burnout and how to prevent it. Yeah, yeah. I look
Excellent.
forward to that. So I'll be seeing you soon.
Excellent. We see
Thank
ourselves
you.
very soon. Have a very wonderful
Thank you very
weekend and
much.
take care of yourself as well.
Same to you
Prevention
too. Bye
is
bye. Take care.
prevention is
Bye.
better than all. Thank
All
you.
right. Take care.
All right then.
Bye.
Bye
Bye. Bye.
bye.
Bye.
not know what state of God you are, it's a disaster. To not know your purpose is a tragedy, it's a disaster. To live and not know what state of God you are, it's a disaster. To not know your purpose is a tragedy, it's a disaster. You may tomorrow be gone, tomorrow may never come. Wake up, wake up, wake up, wake up to purpose for living now. In this you will build your soul, in this you will be the difference, in this you will be the answer to the prayers of humanity. In this you will build your soul, in this you will be the difference, in this you will be the answer to the prayers of humanity. To live and not know what state of God you are, it's a disaster. To not know your purpose is a tragedy, it's a disaster. Sunshine, rainfall, half spins, the wind blows, harmony, symphony, purpose. Sunshine, rainfall, half spins, the wind blows, harmony, symphony, purpose. The world is waiting on you. Do you feel free? The world is waiting on you. Shine, oh shine, shining like a star. Oh, shining so bright, yeah. Ooh, ooh, yeah. You make tomorrow be gone, tomorrow may never come. So wake up, wake up, wake up, wake up to purposeful living now. And this you will build your soul, and this you will be the difference, and this you will be the answer to the prayers of humanity. And this you will build your soul, and this you will be the difference, and this you will be the answer to the prayers of humanity.